additional $2.6 million problems, which have preliminary been approved, and those numbers will be reflected in our next public report in less than 2 weeks. So the program continues to expand. But I wanted to share an example of an amazing example of one of the cases that we helped. There was an applicant in the West Valley who applied for rental assistance. She was awaiting a kidney transplant. She went through the interview process and then was notified that a kidney was available. She was approved for rental assistance. She was notified by her family that she was going to be able to get that. And she said, "Thank you for the assistance you provided to me and my family in our time of need. I was so worried that if I had to move or not," she was worried about having to move or not. In the midst of that, she got a call while in the hospital and learned that she was eligible. So what she's saying is, "I'm going to be all right. My family's going to make it. And I thank you from the bottom of my heart." Now, not every case involves somebody who's waiting for a transplant, but I wanted to share that with you because it's really a profound example of some of the people that we're impacting throughout the Valley. On September 16th, the Board of Supervisors also approved expanding funding for rent assistance by providing $6.25 million additional, in addition to the $30 million originally appropriated for rent assistance. And that money is being used in Mesa. So the county has an intergovernmental agreement with Mesa. They will be administering the program. The overall guidelines are the same as the county's program. That is income eligibility at or below the area median income, which is equivalent to 300% of the poverty level, and also payments of $1,500 a month, flat payments. So Mesa will be able to provide over 3,700 months of assistance. And Mesa has a website that will be available on the press release that we'll have that will let folks know how they can access information and assistance from Mesa. The other program we wanted to mention was utility assistance. And you may recall that when we first talked about rent, I told everyone that our intention was to bundle services when we providing rent assistance to also make utility assistance available with some of our federal funds. And we have. So some of the families getting rent are also getting utility assistance when they need. But we found that to be cumbersome and limiting. The federal program has a lower income eligibility level and a lot more requirements for documentation. So it was slowing down some of the processing to try to give families all that they need. The Board of Supervisors know what families are doing in terms of struggling with utility payments. And so the board has provided an additional $6 million now of county CARES funding for utility assistance. And that assistance began to be offered again through community action programs on Monday of this week. So the eligibility levels mirror what we have for rent. We're trying to make this as simple as we can here. We'll pay a one-time payment of $1,000 for families for gas or electric payments. And we think that'll help families with about 2 months on the average of utility assistance. We had a family in the East Valley who needed both, and a grandmother, in fact, who gained custody of her 3 children when her daughter passed away due to COVID. She was employed, but she was overwhelmed immediately with caring for the 3 additional children and unable to take care of the costs associated with the crisis going on in her family. So she was provided assistance. She said to us upon learning, "Oh my God, thank you so much. You're truly a blessing. I can now buy my grandbabies some shoes and clothes and not have to worry about where we will go if we don't pay our rent and our utilities." I'm so grateful to you all. So there's many stories. These 2 were really impactful examples for me. But we're finding people who have never had to apply for assistance before. We recently helped a gentleman in the East Valley who said, "I've worked all my life, and due to COVID, I'm not able to pay my rent and keep a roof over my head. I'm scared of becoming homeless." He said, "This is a humbling and stressful experience. I've never requested assistance like this. I don't really know what to do. The caseworker assigned was so helpful, had patience, treated me with dignity, and I just want to express my gratitude in terms of utilizing the Community Action Program services." So the services I'm describing are primarily delivered through a network of nonprofits throughout the community. So we're acutely aware, as is the Board of Supervisors, the impact on nonprofits. They've struggled during this crisis too. not only with workforce, but with funding issues. So the board approved $5 million for a nonprofit assistance program. It'll help nonprofits who have increased demand for services in this time or decreased revenue because of the pandemic. And that revenue may be necessary for them to even be sustainable, or increased expenses due to COVID. And it may include making modifications for how they deliver services, perhaps physical barriers in terms of being able to stop the spread, or other ways electronically to communicate with clients. So building on the success of the county's small business program, we're again utilizing the Arizona Community Foundation. And beginning next week, notices will be sent to nonprofits throughout the community who provide basic human services, essential services to residents of Maricopa County. We expect to award between 25 and 200 grants to nonprofits. The reason there's a big range is because the amount of awards will be between $25,000 and $200,000. So we're really excited to be able to help our community partners, nonprofits, who are serving so many families, help them become sustainable. The last piece that I just want to introduce is food assistance. Again, the Board of Supervisors, hearing the impact on the demand from the agencies, approved $3 million for food assistance. We have found the ideal partner, the Arizona Food Bank Network, with the experience, expertise in grant making, and have an established system and network throughout the county. So I'm very pleased to introduce Angie Rogers, President and CEO of the Arizona Food Bank Network. Thank you.
Thank you, Bruce. And thank you to the entire Board of Supervisors who were approving of these funds. I think they recognized what we all know is that we have many of our struggling neighbors right now in our communities, and we want to be here to help. While we are not typically a funding organization, we are pleased to offer our expertise and ability to get these funds out quickly. Recently, we completed a granting opportunity, and in that round, we funded 165 organizations for a total of $1.4 million. These additional $3 million will allow us to serve more Maricopa's with food insecurity. We expect to find many heartbreaking and heartwarming stories. Grants will be provided to large organizations who distribute 1 million pounds of food or more each year. Their stability and consistency in helping to feed large numbers of Maricopans safely is important. Funds will be used to buy refrigeration, freezer space, repair older equipment. It may help to pay staff salaries and recognize the overtime that many are working right now. And it may be used to help buy food to ensure variety. We want to make sure that we have transportation resources to get to seniors and others with disabilities who may be shut in due to COVID or other health issues. We will provide grants to small organizations. These might include small churches and community-based organizations that provide the variety of services that Bruce just talked about. These families' access to food depends on the stability of these organizations to stay open and stocked with food. We made this opportunity available nearly 10 days ago and already have requests for more than $1 million from 50 organizations. I also want to thank our 2 member food banks. Without them, this would not be possible. St. Mary's Food Bank Alliance and the United Food Bank in Mesa. These organizations are critical to the food supply chain. Their large warehouse operations ensure that food donors have a reliable place to take food, and smaller organizations rely on them to store food in large quantities until it can be delivered. This entire system is critical for individuals like Michael. Michael was recently laid off due to the coronavirus. He's been unable to work at times because of fear of going into people's homes. Before the coronavirus, he had never received assistance from anyone but the occasional food bank help. They are both hoping that when this is over, they'll be able to return to their jobs. People like Evelyn, who lost her job 7 weeks ago and has had no income. She worked as a server in a restaurant, and most of her income came from tips. It's been very hard for her to get by. She is the only breadwinner for herself and her young son, Alejandro. Without the help of the food bank, she's not sure where to turn. She's worried about things not returning to normal. She's worried about people not coming to restaurants, and she's worried about obviously being able to protect herself when she is able to go back to work. She wants folks to know she's a hard worker. She's looking for a job where she can contribute to others, maybe helping in a healthcare organization. One day, she's hoping to help others who might be in need. So I want to thank, again, the Board of Supervisors and all the amazing people working to address food insecurity in Maricopa County right now. Thank you.
Thank you so much, Angie. Thanks so much, Bruce, for your time today. At this point, we'll open it up for questions. And Ron, go ahead and tell me if we have anybody on the line with their hand up.
Fields, at this point, there are no questions.
Okay. Well, we'll give it a few more moments.
Peter Seymour has come through. Peter, your microphone is unmuted. One moment, Peter. You need to unmute your microphone, sir.
Yes, here we go. Thank you very much. I just wanted to confirm some of the numbers that were announced today. The headline in the email release said 20 million to boost COVID-19 relief efforts. I found about 5 million for rental assistance and 5 million for nonprofit orgs. Can you just help me with the numbers, how we got up to 20 million? One last time, I was taking notes, but I just want to make sure I get it all right.
I understand. I'm looking over at Bruce right now because we did the math on all these new programs, and it's 5 million for nonprofits. It's 3 million for the food bank assistance. It's an additional 6 million for adding in Mesa to the rental assistance. Also another 6 million for adding utility assistance, and that adds up to $20 million. This is all in addition to the previous appropriations for the CARES Act funding.
And so,
go ahead, Peter.
Yeah, well, and just to clarify, I know Mesa had its own programs for some of these things, along with Phoenix, but now the county is helping out Mesa in this one regard.
That is correct in this particular regard. We've talked about that a little bit in the past because Phoenix and Mesa also received CARES Act funding. They appropriated it in different ways, and I'm looking over at Bruce. Do you want to expand on that? It's really so Mesa. A lot of the applications that were coming into Bruce's group were coming in from Mesa residents, and instead of turning these people away, because despite the city and town boundaries, we could see a large proportion of those people needed some assistance. Phoenix does have its own program that's very similar in many ways to what our Human Services Department is running. But these folks in Mesa, they needed a more direct line to assistance, and the Board of Supervisors thought it was appropriate to go ahead and appropriate $6 million to those residents in Mesa. Do you have anything else, Peter?
I think that explains it all. Thank you.
All right. I'm here to explain. Thanks. Ron, do we have anybody else? Oh, I'm sorry. And I'll let Joanna step up here. I'm usually not the subject matter expert on the stand.
Y la pregunta es que se confirmen algunas de las cifras que se han dado, por ejemplo, 20 millones de dólares, que es exactamente lo que va a cubrir. Pero 5 millones serán para asistencia de renta, 5 millones para agencias no lucrativas, también 3 millones de asistencia para bancos de comida, 6 millones para el sistema de renta en Mesa y 6 millones para los servicios públicos, para asistencia de servicios públicos. Cabe mencionar que Phoenix, Mesa, también ellos recibieron sus propios fondos de CARES Act anteriormente, pero ahora Mesa también podrá solicitar a través del condado este tipo de ayuda. Phoenix tiene su propio programa de asistencia y seguirá de la misma manera.
Thank you, Joanna. Ron, do we have anybody else with a question?
Yes, Fields. Next up is Nyala Charles. Nyala, you are unmuted.
Yes, thank you so much. I have a question slightly off topic from this, but in regards to the latest coronavirus numbers we have. So with the positivity rate going up within the last week and the R0 now being above 1, what does the path forward look like for the county in terms of businesses reopening, maybe even public health services? Are those numbers being accounted for, and what is your reaction to that in regards to the other COVID numbers?
Yeah, that's kind of interesting. Obviously our epidemiology department over at Public Health, they crunch the numbers every day that come through the system that ADHS has at the state level. So we're watching these numbers, but the mission for public health doesn't really change. And by the way, the county has nothing to do with shutting down businesses or any of those executive orders that are in place from the governor that restrict the activity of certain businesses out there. So public health is here to educate. We're here to crunch the data, provide the absolute best information possible, and then create guidance based on that information. And, the guidance at this point is to choose the mitigation efforts that are underway. Mitigation, such as wearing masks. We know that the masks work. We know that they can help mitigate the spread of the disease community-wide. And we certainly don't want to go back to the spike that we saw in June and July. And I know that's underway right now. So other than that, we will continue to operate that. And in the meantime, we also have a flu campaign going on right now, and the state is about to launch its flu campaign as well. Very important for people to get the flu this year. That's another mitigation effort that not only keeps you healthy from the flu, but could keep you out of the hospital and perhaps overwhelming our medical system during the winter months, whenever the flu tends to spread widely throughout the community. So again, the advice, small groups, 10 people or less, keeping yourself 6 feet apart, distancing, and wearing masks is another mitigation effort. And public health will continue to push that. Also, washing your hands very often. I'm being reminded from the people behind the camera. I shouldn't forget washing your hands, using hand sanitizer if you don't have soap and water available. If you have other questions about this or you want to dig deeper into the data, I suggest sending an email to the Joint Information Center. We'll do our best to answer those questions. And specifically, if you have questions about data, we'll try to dig into that a little bit more. Thank you for the question, though. Ron, do we have somebody else? And then I'll let you. Hang on a second, Ron. Put him on hold.
Yep.
Entonces, la pregunta fue que ahora con los números de coronavirus que se está viendo, un índice de casos positivos que están subiendo poco a poco y que ahora que se reabrirán los otros servicios o negocios, ¿cómo afectará? ¿Cuál es la realidad de lo que se está viviendo? Bueno, acabo de mencionar que la misión de salud pública del condado Maricopa es dar los números de lo que estamos viendo en la comunidad. Nosotros no cerramos ningún tipo de negocios, no damos ningún tipo de pólizas acerca de eso, sino damos guía de mitigación. Por ejemplo, el usar la mascarilla constantemente, también que previene la propagación de COVID-19. Otra de las cosas también de recomendaciones que se le recomienda a la gente que siga lavándose las manos constantemente con agua y jabón o con el desinfectante a base de alcohol, también el uso de las mascarillas y por supuesto estar en grupos pequeños. Y también en este momento es importante recalcar la campaña de vacunación contra la gripe que ya entró en vigor y la gente puede vacunarse, es otra forma de mitigación, también de evitar que haya un gran número de personas yendo al hospital por la gripe.
Thank you, Joanna. I apparently need a constant reminder of the translation following my answers. I'm used to directing traffic more. Thank you so much for the question, too. Ron, did you have somebody else?
Yes, Fields, we do. Nicole Gregg is up next. Nicole, you'll need to unmute your microphone.
Hi, all. Thanks for taking a question. It's a little bit longer, so just bear with me for a quick second. But I've been really digging into these rapid tests coming to Arizona. They're intended for schools. First off, schools would need a waiver as they're intended for lab settings. Second, this would fall on school nurses or employees to be trained. And third, new info out of Johns Hopkins expresses concerns that the published data on these tests, they have not been done on people under 21. So it's unclear how accurate this test would be in kids. Does the county know what they're possibly getting and signing up for from the state, or are there concerns with all of this?
I would say there are not concerns, but I think as we've told you, Nicole, we're waiting on some more information. We certainly have constant communication with the Arizona Department of Health Services. We know that these machines will be coming into the state, but it's still unclear how are they going to be distributed, who is the priority, all those things. But Maricopa County Department of Public Health would be a part of those conversations, helping to make those decisions. And certainly if there are those more critical questions that you're asking and you're getting information about, our experts will be there with the state determining the best way to use these and which organizations should be using them. But that's about all I can tell you at this point.
Y la pregunta es que con las pruebas rápidas que han estado llegando para las escuelas, también que es específicamente para entrenar a las enfermeras que estén bajo este tipo de programa, y un estudio reciente de Johns Hopkins que reporta que este tipo de uso no se ha utilizado en los menores de edad. Bueno, ¿no nos preocupa acaso lo que está revelando este estudio? Basado en lo que IDHS, o el Departamento de Servicios de Salud de Arizona, está haciendo. La realidad es que las máquinas van a llegar al estado de Arizona y el estado es el que dará guía quién las utiliza o cómo las utiliza o dónde se utilizan.
Nicole, thanks so much for the question. Ron, do we have somebody else on the line?
Fields, there are no other callers at this time.
All right. Thank you, everybody. Thank you for the good questions today. We always appreciate it. We will continue to answer questions via email, phone calls, as you guys have more of those. Thank you to everybody on YouTube and Facebook joining us as well. If you're listening in, we appreciate that. One reminder I have to say as we go out, we have a flu campaign going on. And by campaign, I mean we have a number of events. If you go to maricopa.gov/flu, there are flu events that are free to the public. They are in targeted areas of the city that typically groups that don't have a lot of access to healthcare, but there's also a vaccine finder on there, which is incredibly helpful. And if you click on it, it's a geolocated map. You can look through your neighborhood, find every place, whether it's a CVS, a Walgreens, or your local doctor that has flu vaccine right now, and you can schedule an appointment and go to one of those places. But we highly recommend it, and by we, I mean public health highly recommends it this year to get that flu vaccine, protect yourself, protect those people around you, and certainly stay out of the hospital during this season. Thank you so much for being with us today. We will see you next time. Appreciate it.